Thank you very much. I think we are ready to begin and to kick off this next discussion, which looks at the successes that we have built as a community so far in advocacy. We have described the process in our previous panel. We have seen some of the evidence that we can use, some of the tools that we can employ. Now it's time to hear from our fantastic ambassadors who are doing an amazing, amazing job everywhere in the world, from Lebanon to the Netherlands to the United States. I am delighted to welcome on stage Chyrel, Aedan, and Scott to hear all about the fantastic, fantastic job they're doing. Yes, that's the spirit. Fantastic. Okay, you can sit wherever you want. Thank you so much for joining me. I think this is one of the more informal discussions because we need to take time to celebrate the achievements when it comes to engaging on world stages. Actually, it's not just regional, it's not just national, it's not just European, it's global stage at this point. And Chyrel, I would like to start with you. Since you played a critical role in restating access to life-saving medicines for HoFH after political transition in Lebanon. So my question to you is, what were the practical steps? What helped you into building this approach, into speaking up, and into persuading these new leaders to act on your behalf and on people who live with the same disease as you?
So I think I want to start with mentioning that one of my biggest parts of my advocacy journey was taking everything that I've learned, every skill, every tool, and every piece of guidance from this community and make it work into Lebanon's, let's say, unpredictable healthcare system. And so we had to adapt swiftly to the changing of presidency, as you said. So we had new presidents, that means new ministers, and with that came along new team members. And we already had an ongoing struggle with the apheresis. So even though the decree was there, even though the policy was there, it was not implemented. So we had to treat this as a clean slate. So we had to, new briefings, new context. We had to assume that instead of assuming actually that they knew about our situation and ongoing struggle, we prepared. And I want to also say that everything that I've ever did in this with FH Europe Foundation was to prepare me for this second, for this moment, because it is 10 minutes a meeting with the minister and with the president. It is really 10 minutes. And the struggle was to fit everything that I've ever learned and implement it into those 10 minutes. But also, I quickly reached out to Mădălina and I said that we need to prepare something for this meeting. So we prepared a document, a precise document, with everything that, every relevant resource that I could have access to, clear numbers, and also the specific, make them understand the specific consequences of inaction. So also I think our powerful weapon was sheer storytelling. So I went, but also I was not alone. We had with us our youngest advocate, Mark, who's 14, and he's living with HoFH, and his mom, and she's the definition of mama bear, if you know that. And also we had with us Saidi, who is a mother of a young man that sadly passed away due to the unavailability of this treatment. So I think this human element really created a connection that data alone cannot achieve. So we went along with the data, but also with the evidence and with the lived experience. So yeah, the struggle was to fit all of this in this small window, but we were, as I said, prepared, we were precise, and we were persistent. So yeah, it worked in our favor, and we had the re-implementation of the decree, and the apheresis is now back in Lebanon.
Well done, exactly. Round of applause. That is a fantastic success story, and thank you for doing this for your community, our community, because a success that starts at small scale, it always has an impact on us, on our morale even. We see that this is possible, it can be done. So thank you for the inspiration. I heard some buzzwords here that do resonate a lot and have a link with the discussion in previous panel. So we have small windows, we have to be concise, we have to be very precise with what we are asking and always come up with that solution. So I think that really summed up an hour-long conversation with your example. Thank you so much, Chyrel. Moving to Aedan, you have been very deeply involved with raising awareness on LP(a), especially stemming from the Global Summit in Brussels to youth consultations with the European Commission. My question is, what did you learn, about engaging with policymakers and professionals so that patient voices are truly heard and truly lead to change?
Just check if it's online. No. We'll use this one.
Perfect.
First of all, thank you all here for being here to begin with. I think it might just be highly ironic that I'm sitting here on my own telling you all of the success stories behind what we've done here, when in reality it should be the entire team of FH Europe and more standing on this stage right now. So for that part, that I'm already very thankful for. As for the success part, it can be broken down into a couple of factors that are at play. The very first one came with a certain word that's quite important, and it's called being prepared. Being prepared for whatever might come across of your path, but especially working with already a clear structure. I'll take the LPA Global Summit as an example. We didn't just go in there with every expert in the field thinking we're going to have a wonderful time, spend a weekend together in Brussels and see what we do. We actually had a base working on something. We had a draft proposal of the official LPA Global and International Declaration for Testing and Management. And that's something that's really powerful, because having that clear guidance and that clear structure will accelerate a consensus paper. And that's very important, because it allowed for us to create something that any stakeholder could react towards. And that's vital. Secondly, we had something else. And that's across every single thing that we've done, both in the LPA Global Summit, with the youth consultation and the EP event. And that is a design for co-leadership, not just participation. Young patients, old patients, anything in between and above or below or anything according to those lines, we're all there in that room, not just to participate as a label, but actively involved in shaping the content that was being discussed. And that is vital to do, because doing so not only allows for you to clear some gaps in between, but it also allows you to properly understand where everyone's coming from. You have a certain level of depth. You can put it into perspective. Thirdly, and this one's a bit of an open door, having any of our activities and any of our 4 main disease areas be linked to any form of presidency, or for example, be it the Polish presidency of the EU Council, if I pronounce that correctly, or be it in connected with MEPs or the DJ Santi team or anything, having that political backup immediately allows for a much more accelerated consensus and a very clear notion of knowing that what you're doing is vital and that what you're doing is needed. And you have something to back it up, be it from a political standpoint, be it from an international standpoint, or just emotionally. Fourthly, and that one's also quite important, is the communication part. If you are capable of pronouncing what you wish to say within 1 minute, then you're golden. If you can't, then you have trouble. Because everyone in this whole world is going to be looking at you, listening to you, but they have their own agenda. And you need to be able to fit in that agenda, and you need to be able to discuss with them exactly what is important, but not just what's important, who's in front of you. Why are they there? What do they do? And why do you wish to talk to them? Those are important, vital information that you need to know. So if you ask me, what would be the critical success factor? It would be teamwork, collaboration, and a lot of preparation. And of course, having a lot of fun. Thank you very much.
Fantastic. Thank you, Aedan, for summarizing so clearly what is needed to be able to show up and able to represent your community in the way that the entire youth community of FH Europe it's doing. And we've heard about preparation. That is the common denominator there with Chyrel's story as well. I liked the fact that you mentioned this design for co-leadership. It takes more than one person to build a story and to have a conversation with, and that again is linked to merging our interests as a community and the interests of the policymakers. That is essential to make sure that we speak the same language, that we are asking the same things. And I see you want to intervene.
To add on top of that, I'm going to level something with you all. For example, with that preparedness also comes a certain preparedness because you know how to inform the person in front of you, but you also know the misinformation that might come at play.
True.
To give you a very solid example, during the youth consultation with the European Commission team, with the DJ Sante team, I had my talk about LP Little A, and the very first response that I had was that they couldn't discuss rare diseases. Now, I don't know about you, but I think 1 in 5 is not quite rare. So it is very important that you need to be prepared for such circumstances. Not to say that they will happen, because they can also not occur, but you need to be prepared anyway. Because if you refuse to let yourself be boxed in, while at the same time being able to provide that clearance to everyone in the room, that is what truly will make them not just hear you, but act on your words.
Absolutely, fully aligned on that, definitely. Thank you, Aedan, for sharing your experience and for giving us this valuable tips on how to interact with people in power. We are going to move to Scott now, who is joining us from the US. And Scott, you've joined FH Europe around 2 years ago, and you've been through the ambassadors program as well. But now you are taking your advocacy at a whole new level. I'm not going to even mention what that is. I will let you tell the story because I think it's quite fascinating.
So my name is Scott, and I am living successfully with FCS. And it's a genetic disorder, but it's not contagious, so you can't get it from me. So don't worry about it if you're in the elevator with me. You can't catch it. But what I do is I stand in the corner when we're eating food and say, hey, does this have fat in it? Do you see oil floating in it? Is it acceptable? That's what you see us do with FCS because we are rare. And what we do when we're rare is we stand out sometimes and we do things that are different. Mm-hmm. Yes. So, what we do when we're different is I'm the guy that's not smart enough to talk to on an educated level. What I do is I'm the hype guy. I'm the relationship guy that gets you fired up and excited and then hand you to the smart people that can really talk to you about what we got. But what I learned in the ambassador program is that I had no idea what some of these words were. Heterozygous, homozygous. That's too many letters for me. But what I do know is that I have FCS and I want people to understand. So anyone that comes in around me knows about FCS because I've got something on me because I'm willing to share. So here's what I want you to do is as the old guy up here with these young folks, what I want you to do is in North Carolina, where I'm from, we say y'all. And what y'all stands for is everybody, right? So all y'all is plural for the whole room, okay? So on the count of 3, it would do my heart and my patient ambassador heart wonderful if I could hear you say y'all. So you ready? On the count of 3, 1, 2, 3.
Yo!
So what that did is it lets me know that you have a voice. And what we need for you is to come and share your y'all with anyone who will listen. That's what the Patient Ambassador Program did for me, is they gave my y'all a place to represent people living with FCS. And what I've done is, how many of you in the embassy from your country knows that you are here in Croatia? How many of your embassy knows that you're here because you emailed them? Guess what? Yours does? Fantastic. My embassy and your embassy knows that we are here because we emailed them. That's what we've got to do, y'all. We have to let people know that we're here because we are a force to be reckoned with. And so that is my encouragement for you, is my phone is on the table. Get your machine out that you pay for every month in this thing called Google, and find your embassy and let them know that you are here at FH Europe Foundation 2025 in Croatia, and they should be here too. So bring it.
Scott, that was fantastic. It was literally the kind of confidence building example that we were hoping to see as the result of, an ambassador program, the support that these people, these folks are bringing to us to, make sure that we can come up with messages, we can bring them across and get people to listen to what we have to say. So thank you, 1,000 times. In closing, because we do not have much time left, I wanted to bring in a bit of my own perspective. As I mentioned earlier, I'm very, very new to this entire world, but what I do know, it's policy, it's advocacy, I understand how institutions work. However, this experience with FH Europe has opened opportunities and possibilities for me to see more of the human face, more of the human stories. And that was perhaps the highlight of the European Parliament event, where everyone was literally silent when patients came with their stories. That was the moment when everyone was listening, from policymakers, from scientists, from industry. Everyone was paying close attention, because that is the force that it's driving all the numbers, it's driving all the data, all the information. So if we have this coupled, I think we have a recipe for success. And this is what I've seen in the ambassador program as well. It's giving us the tools. The enthusiasm we get from each other, and especially from Scott. Thank you so much. Yes, the report for the event, no. Okay, I wasn't sure what Mădălina was trying to show me at the back, but we will have a summary of that event, which will be distributed to everyone in the next weeks, so you can see what was all about, what the stories meant for the entire community. And with that, I will thank you, and I will invite Nicola for the next session. Thank you so much.